So good morning, everyone, and warm welcome once again to our reading club. So we have been reading Dr. Prafful Vijaykar sir's books. So we are so happy to read, to start from the basics. And we have already read with the first book, that is the theory of suppressions, and then the theory of acutes we have done long back. Now we are straight into the book about the third book, that is the end of my assumption of miasm. And here we are in the chapter number 7. So the more we read Prafful Vijayakar's book, the more thorough our foundation, how strong our foundation becomes. And what my suggestion is, before we jump straight into the delusion, delirium rubrics, first of all, you have to always be double thorough with the basics. So now we are into chapter number 7. We have already done with the 3 miasms. That is the psoric, psychotic, and syphilitic miasm in the form of inflammatory defense, and then the constructive defense, and then the destructive defense. We have been talking about the various defense mechanisms of the cells, and there are only 3 defense mechanisms possible in the cell. And one is the inflammation, where it is totally physiological, and whether you give medicine or not, it will have an end to it. Either the inflammation will end and the patient will survive, or it can go into detrimental and the patient can perish. These are the only 2 possible things there, the physiological defense, and it is completely reversible as well. And then the second thing is the constructive defense, where you get the psychosis and all the accumulations or the depositions and synthesis, etc. We will go into detail in the coming chapters. And then the third one is the destruction, the necrosis, and that is known as syphilitic in homeopathy. So only 3 miasms are possible. Let us not get confused with malarial miasm, cancer miasm, typhoid miasm, what not. So let us stick to the basics, where what treated by or what given to us by Dr. Samuel Hahnemann. So Vijaykar sir is an ardent fan of Dr. Samuel Hahnemann, and for anything and everything, he will quote from the aphorisms and he will quote the master's language. So according to modern science, so here it is a comparison with homeopathy and with the modern science, the material body defense vis-a-vis miasm. Okay, so according to the modern science, the inflammatory and irritative pathologies seem to emanate from the physiological defense. Yes, that's what we are all thorough with the psoric miasm, that is physiological, that is totally inflammatory and irritative. Then the second point is the growth pathologies seem to emanate from the constructive defense. When the cell is tired of the inflammatory defense, it will take the next protective mechanism, that is the constructive defense. And the third one is the destructive pathologies seem to emanate from the destructive defense. Of course, when the constructive defense comes to a tipping point, the cell will open up the next thing, that is the destructive defense. So these are the only 3 possible defenses. Hahnemann in Organon aphorism number 79 and 80 mentions. So the above lessons, the above 3 points are from the modern science. Now we are comparing that with what our master said about this 200 years back. In aphorism number 80, he talks about chronic miasm of psora, which announces itself by a peculiar cutaneous eruption with intolerable itching, and which is the fundamental cause and producer of numerous or innumerable forms of diseases. Transient explosion of latent psora gives rise to acute diseases. So what did we just now read from the modern science theories? So psora, that is the fundamental cause, and transient explosion of latent psora gives rise to acute diseases. And all these acute diseases are nothing but they are the reaction to the injurious influences, which means they are physiological, which end in recovery or in death. So acute diseases are like that. Either they will end with a recovery, complete recovery. There will be no signs, there will be no scar tissue, or it can go into death. So this is the physiological thing, and that is, we call it as psora. Examples are there. Acute inflammatory diseases like pneumonitis. Yeah. How many of you have seen pneumonitis? And how many of you have seen the complete resolution of pneumonia without even leaving the slightest of the scar? The bronchitis and then the appendicitis. I am sure every one of you would have seen all these kinds of diseases like bronchitis, everybody 100%. Pneumonitis, maybe 90% of the people. Appendicitis, yes, almost 90 to 99% of the doctors would have seen appendicitis in your clinic. And with one dose of the medicine, beautifully it will evolve out. Even with leakage or spillage of fluid around the appendix or in the right iliac fossa, if there is fluid collection, if it is threatening the suppuration, or if it is threatening to burst, even at that point, we have got something to do for that. And there is a complete resolution. Yeah, you would all seen that. Then the next difference is psychosis, that is the condylomatous disease, disease of growths. And see, all these things are said by our master Samuel Hahnemann in the aphorism 80. And then the last one is syphilis, the venereal disease with chancre, that is the disease of destruction. 200 years back, Samuel Hahnemann could only do this much. He could only see it as itch, and then he correlated that this is a kind of a defense mechanism where the disease comes and goes. Where the disease comes, it stays for a while. After the inflammatory or the irritatory process is over, the disease totally disappears. Then the second mechanism where he had seen lot of growths, that is condylomatous growths, lot of warts, all the cauliflower like big growths. That is we actually said it like the gonorrheal miasm, and that is, he has termed it as psychosis or the condylomatous disease. And then there are another category of disease which our master keenly observed, that it was totally destruction with the chancre, with the ulcer, with the bubo, and it was a kind of a venereal disease, STD, and it was termed as syphilis by our master. So there are only three defenses: inflammatory, constructive, and destructive. And in homeopathy, we term it as psora, psychosis, and syphilis. From the
Ma'am,
above,
sorry
yes,
for the interruption, ma'am. Somebody asked about the page number. I think Dr. Sai.
yeah, the
Page number.
page number is 76. Sorry.
Okay, okay. Thank you, ma'am. Thank you.
Yes. So from the above similarities, one can safely presume and conclude that Hahnemann's miasms of psora, psychosis, and syphilis have its roots in the defensive response of a cell to injurious influences. We said that once we take birth, until death, life is all about the drama from birth to death. Until death, there are a lot of injurious influences. Every day there will be many of them. For all these injurious influences, how do you respond? How does your cell respond? And that is your defensive mechanism, and that is your miasm. So if you are giving a physiological defense, that is psora. And if you are giving a constructive defense, it is psychosis. If you are giving a destructive defense, it is syphilis. So all these are the various reactions to the stimuli. So Hahnemann and modern medicine. So there is a lot of comparison here. We shall just brush it through. We are all thorough with that already. So Hahnemann says psora is the first reaction to stimulus. Yes. How many of you agree? Yeah. Syphilis is not the first defense mechanism. The first degree defense mechanism is always inflammation, and that is psora. In modern science, what do they say? Physiological defense, that is inflammation, is the first reaction to stimulus. Yeah. The second point is Hahnemann is saying psora is the only real fundamental cause. And further, he says all the diseases of psychosis and syphilis are based on psora. And psora is the mother of all miasms. And modern science says physiological defense is the first response to cell injury. Yes, it is in parallel. All the other defenses like constructive or destructive are secondary to primary physiological defense. And irritation or inflammation is the beginning of all the diseases. So these are all one and the same. Now Hahnemann says further, psora is not to be equated to itch or any skin lesion. Psora is that condition which prevails in cells and tissues of the whole organism before it expresses itself in the form of itch, vesicles, intolerable itching, etc. What does this mean? This miasm, the itch is not the psora. Psora is that condition in your body. Your body is already changed into psora. Only then you are resonating to that stimulus in the form of an itch. So if your body is already in the psychosis phase, in the psychosis background, your body will respond psychotically to the stimulus. If your body is having predominantly syphilitic, already it is syphilitic trait is running through you, then you will be reacting in the form of a destructive mode to the same stimulus. So your body is, the condition of sora is already implanted in you, and that is the reason why you respond in the form of itch or vesicles or intolerable itching. The itch is not sora. The sora is that condition of your body. So aphorism 80, sora announces as peculiar cutaneous eruptions after the completion of internal infection of the whole organism. The whole organism is soric. It is not that the itch upon the nail or around in the fingertip, that is sora, or itch around your lips, that is sora. No, your whole body, the entire constitution is soric constitution. And when a stimulus is given, you will respond in the soric form. Sora is specific internal dyscrasia due to inhibition of nutrition and oxygenation. Of course, that is physiological. There is a physiological stimulus, inhibition of nutrition, inhibition of oxygenation. Then your cells are bound to respond in the form of inflammatory or in the form of some change in the biochemistry. What does modern science have to say here? The primary response to cell injury is determined by hypoxia, see, and ischemia, that is, lack of oxygen and lack of nutrition to the cell and tissue. The first point of attack of hypoxia is the cell's aerobic respiration, that is oxidative phosphorylation by mitochondria, resulting in decreased generation of ATP. So this is totally physiology. This reduced ATP has widespread effects on many systems within the cell. Sodium-potassium pump is affected, leading to lethargy in the individual and failure of active transport system due to reduced ATP concentration, resulting in isoosmotic gain of water to give rise to cell swelling. Cellular energy metabolism is altered, disruption in protein synthesis, etc. So this leads to reduced cell tissue resistance and infections can easily take place. All these are nothing but the after effects of hypoxia or ischemia, the changes happening, the physiological changes happening within the cell. The cell gets injured, it gets swelled up, there is a reduction in the ATP, etc. Now, Hahnemann is saying something. In acute diseases, burst of latent sora can end in recovery, if not death, either recovery or death. Modern science says acute primary response can be reversible. This is reversible cell injury. If violent, it may end in death. So Hahnemann and modern science, they are in par. That is both of them are the one and the same. So now to come to the summary, SORA is equivalent to physiological defense response. Psychosis is equivalent to constructive defense response. Syphilis is equivalent to destructive defense response. We are still in the material side of SORA, psychosis, and syphilis. See how beautifully Vijaykar sir is teaching us word by word. So is there any doubt as to how many defense mechanisms we all have? Is there any doubt? And how many defense mechanisms we have? Which are they? Yeah? Yes? Okay. So we have only 3 defense mechanisms, which means we have only 3 miasms in homeopathy. Yes? According to our master, Dr. Samuel Hahnemann, there are only 3 miasms, and that is SORA, psychosis, and syphilis. Now, there are lot of variations for the, or lot of gradations for the psychosis and for the syphilis, which we will come later on. We go straight to chapter 8, right? Yes? Are you all with me? Yes? The cell has only 3 defensive responses and there can be only 3 miasms. Okay. So here it is narrated by an example. Let us take an example of a man who is under attack from elements of hostile world. He is an educated man living in a shanty little house. He is being threatened by antisocial elements that are trying to evict him. He has 3 possessions. What are they? One is a pen and some money and a bread knife. So this pen responds to what? A pen is representative of SORA. Then money is what? Representative of psychosis, and knife is representative of syphilis. When he finds himself in a problem, he would like to defend himself using whatever things he possesses. In order to defend himself, he'll make use of his pen to pen down his complaints to the police or the higher law-making authorities. If he does not get help from them, he shall decide to sacrifice his hard-earned money to buy his safety by appointing personal guards. So if it is an Axvomica, or if it is an Ignatia or Staphysagria or any of or Pulsatilla, what will Pulsatilla do? Yeah, Pulsatilla will sit and cry. Ignatia will brood, and Natramur also will brood. Staphysagria will be like indignation. How can this happen? Naxomica, it will try to have some word with the robbers, and then Naxomica is very timid. Yeah, the Sora is in the highlight. What will they do? They will write it down. They will write it down to the police. They will make a complaint, etc. They will not throw away the money in the initial stage. But if it is a psychotic predominant miasm, maybe like causticum or maybe like lycopodium, what will they do? Or our medorinum, what will they do? Lycopodium and all, you know what they will do. They will first, initially itself, they will use the money. They will use the money and they will keep some gundas or they will appoint some black cats to protect themselves. The hard-earned money to buy his safety by appointing personal guards. So all these are done according to your constitution. So the personal guards. If this also fails to deter the invaders, he may get desperate and try to use the knife to defend himself or even kill himself to escape the ignominy of defeat. The best example is Stramonium, who carries a knife. Either the knife will go to himself or the knife will go to the other side. There can be homicide or there can be suicide, anything, because Stramonium is in panic. He doesn't know what he is doing. On similar grounds, the defensive response of the cell is based on conserving, using, or sacrificing its possessions. A unicellular animal like an amoeba has no possessions. This base living animal has only its functions to sacrifice if required. Functions are soric, that means it is inflammatory. Every living cell or a living organism, which is at least deductively its descendant, also possesses the following three basic functions, which can be used to defend itself. One, using or sacrificing the primary or the first function of nutrition and respiration, the cell brings about the physiological defense or SORA. This response starts with hypoxia and ischemia, leading to depletion of energy generation. This in turn affects the cell functioning and health. So the first basic thing is it can cut off the nutrition or it can cut off the respiration. And that is the first physiological defense. Using or sacrificing the second basic function of generation or the cell's capacity to generate, the cell brings about the morphological or constructive defense by sacrificing functions of mitosis, etc., which corresponds to psychosis. So the second thing is the basic function of generation, where it stops the generation or it produces too much of mitosis. Either it can stop it or it can excessively do it. Then the third thing is again using or sacrificing. The third basic function of immunity, that is the morphological destructive defense that is brought about. This corresponds to syphilis. So there are three basic functions of a cell. Therefore, only three basic defensive responses exist. Therefore, only three types of chronic diseases exist. Hence, there can be only three miasms. All others are pseudomiasms. This comparison of SORA to primary physiologic defense, psychosis to morphological constructive defense, and syphilis to morphological destructive defense, and all the diseases having their origin in SORA, psychosis, syphilis, was also foreseen by Dr. Hahnemann 200 years back. Clap, clap, clap to Hahnemann. Now, Organon aphorism 74 is the most important aphorism in the whole book of Organon. It states, among chronic diseases, we must still, alas, reckon those so commonly met with, artificially produced in allopathic treatment by the prolonged use of violent heroic medicines in large and increasing doses. Why Dr. Hahnemann is always comparing this with allopathy? Not to evoke any provocation, but he himself was an allopathic doctor and he himself was practicing all those kind of crude mechanisms at that year, 200 years back. And then he was totally unsatisfied. That is the reason why he is narrating all those things here. This is not to provoke any fight with the allopathic counterpart. So see, by the prolonged use of violent heroic medicines in large and increasing doses, by the abuse of calomel corrosive supplement, mercurial ointment, nitrate of silver, iodine and its ointments, opium, valerian, cinchona bark and quinine, foxglove, prussic acid, sulfur and sulfuric acid, perennial purgatives, venesections, shedding streams of blood, leeches, issues, setons, etc., whereby the vital energy is sometimes weakened to an unmerciful extent. Sometimes, if it do not succumb, gradually abnormally deranged by each substance in a peculiar manner, in such a way that in order to maintain life against these inimical and destructive attacks, it must produce a revolution in the organism and either deprive some part of its irritability and sensibility, that is sora, or exalt these to an excessive degree, causing dilatation or contraction, relaxation or induration, that is psychosis excess and psychosis less, or even total destruction of certain parts. What is that? That is syphilis, and develop faulty organic alterations here and there in the interior or the exterior, that is cripple the body internally or externally, in order to preserve the organism from complete destruction of life by the ever renewed hostile assaults of such destructive forces. What does this mean? With all these destructive forces, whether it is such kind of a treatment or by any constant threat from the external influences, our body has to undergo, our vital force has to undergo a total revolution inside us, either producing a defense like inflammation. What happens in dengue? When you are thrown into such kind of an attack, your body will, everything is turned inside out, no? Even the hemoglobin will be very less, and even the bone marrow is affected, no? The WBC will be very less in the viral disease. The NLR ratio is totally altered. Neutrophils will be sometimes very high and the lymphocytes will be very less. Yes. And the total count will be very less. Yeah. And platelets. Yeah, the platelets will be very less. All these blood, there will be a a revolution is happening inside our body, and it can go into shock or it can go into hemorrhagic shock. Yes, anything can happen there. And we all know, like we should be totally in vigil every 24 hours or every 12 hours. We will have to take feedback from the patient. When we say the disease is in dynamic nature, yeah, all the psoric things, all the inflammatory things are dynamic in nature. Cough is in dynamic nature. Eczema, it comes, it goes, it comes, it goes. Some days it will be on the lesser side, some days it will be on the higher side. The cough, the sneezing, all these things, all the itis things are in the dynamic state. Yes. And there can be another dynamic state, which is, I shall give you this example. When the patient is in the psychotic phase, for example, it is the disease of diabetes mellitus. Even diabetes has got, it is trimiasmatic. Initially, it starts in the form of physiological, or there can be that dynamic variations of the values. Some days it will be 120 or 130, the fasting blood sugar. Some days it will be 150, 160. All these fluctuations are within the limits, so it is not syphilitic. So one day if it is 60 or 80 and the other day it is 210, then it is kind of a syphilitic kind of paroxysm. There you can always think about the rubric delirium paroxysmal, because it is not that dynamic. It is paroxysmal rather. That is a syphilitic rubric, and dynamic is a soric. If there is no rubric like dynamic, but then it is the soric miasm there. When you're treating a person who is having a full-fledged diabetes with very high, that means fasting blood sugar around 250 and postprandial blood sugar around 350 with a single medicine. And if the patient is showing fluctuations, lesser and lesser values, some days lesser, some days higher, no, like you will be taking the pinprick test and asking the patient to bring a range of or many days test values. You will ask them to do the EquiCheck at home itself, and they will be bringing you some 10 values and in a month time. And out of these 10 values, many values will be 80, 90, 100, 80, 90, 100. And the other values can, some days it can be around 120, 122, and also a lot of fluctuations are there. This is the dynamic in the dynamic fluctuation in the diabetes. So the patient was 270 and 350. And now the patient is showing lot of fluctuations. Don't worry about that. Before it comes to a static lesser value of hyperglycemia or normoglycemia, before it comes to normoglycemia, it will have all these kinds of fluctuations. This is a great example of dynamic fluctuations in homeopathy. Why did I talk about this thing is, here I had a great insight that if you have given an XYZ medicine in the 200th potency single dose for the psychotic diabetes, when it reduces, it comes to the dynamic thing. What is that dynamic thing? It is Sora. It is Sora and it is full of dynamism. It is full of movement, which means you can give the same medicine in a higher potency. If it is XYZ 200, say acid force or any medicine, 200 potency, if it is moving a lot, this side and that side moving a lot, it may need a higher potency, like 1M potency. So give the same medicine, 1M potency, because it is similia similibus to the case now, similia similibus to the miasm. It is the same medicine, but then maybe you will have to go higher in order to bring it back to normalcy, complete normalcy. For this altered state, not altered state, but then dynamic state. Altered means it can be opposite. Sometimes hot, sometimes cold. That can be altered. Here it is, the value is not coming to a static level. It has to come to a static level, right? Yes. So this is the dynamism. Any more doubts? That has helped me. Yeah, if in autoimmune cases, according to the susceptibility of the patient, there are several autoimmune cases. In a very slow going autoimmune case, the best potency is 200 potency, wait and watch. For example, a skin condition called SS, what is that? Progressive systemic sclerosis, or in Sjogren syndrome, or in ugly cases of lichen planus, slow or leukoplakia, slow, very slow. You just have to give 200 and then let the case evolve and evolve and evolve. Whereas there is lot of syphilitic fluctuations or maybe anything destructive going on, maybe rheumatoid arthritis or something. And the patient is totally crippled and the patient is having terrible pains, especially in the nights. The syphilitic pains will be more at nights, right? And the patient is deprived of sleep and that is affecting the whole thing. There, the susceptibility of the patient is very high. And what is the potency? Ideal potency will be 10M. Yeah. And if it is going towards death, for example, if it is going towards coma or kind of a hepatic coma or kind of raving and all, or the COVID kind of symptoms where a ventilator has to be kept, etc. What is the potency? 50M. That is also autoimmune. That is going towards death. That is going towards death. And the best potency will be 50M potency or at least 10M potency, repeated frequently. Yes. So all these things, whether it is autoimmune or whether it is any miasm, any stage, the potency and the repetition is determined by what? By the condition, by the susceptibility of the case before you. So that will keep on changing from case to case. In the same patient, you will want to reduce the repetition after some time, and you will want to give the GCS after some time. You will want to give the 200 potency single dose after some time. When the patient has already come out of the grave situation, no need to keep on giving the 10M or 50M every now and then. You have to reduce that. So all these things are determined by the susceptibility of the person. Got it, dears? Got it, dears? Are you with me? Yes, Sai Narendra. Yes, thank you. Yes. Any doubts here when we talked about autoimmune and all?
Ma'am, for diabetes, autoimmune diabetes case, weight is improving and overall improvement is there. Again, this fluctuation like 130 to 200, like that, within 250 is there. And still, how long we have to wait, or we have to repeat, as you said, and the higher.
As long as the generals are getting better, you need not repeat. But then if for a reasonable amount of time, if for a reasonable, you see, what you said here is, Arya, the patient is improving in his weight, which means the patient is showing improvement. When the patient is already under improvement, you don't have to go to the higher potency. But then if the patient is kind of static and the sugar is totally under fluctuation here and there, you are not able to do any further. You are not able to go any further. At that time, in order to speed up the complete cure, you can always repeat the same medicine in a higher potency, because the
Okay.
psychosis is gone now. The psychosis is gone. And the patient is kind of fluctuating here and there. The soric dynamism has come. With the soric miasm, and especially when the patient is showing lot of dynamism, at that time a higher potency will work like magic. You can immediately bring it back to a normal level. In your case, Arya, the psychosis is still on, or the nutrition or the vital force is getting stronger and stronger day by day, and the patient is showing improvement in his weight gain. So there something constructive is happening there. It is still in the psychotic miasm. So there, I will not suggest you to go into the next higher potency. Okay.
Okay. Thank you.
Okay. So now we are in page number 81. Organon aphorism 74. Okay, we have read that in detail, and now we have come to the three miasms again. That is the soric miasm, and then we were talking about dengue, yes, and that was it. Like the total that he had used the term revolution. When we are infected with that virus, what happens? Any infective agent, there will be a total revolution inside our body, and then we produce these symptoms, whether it is inflammatory or constructive or destructive. So in the case of a constructive, he had given all the four possible changes. Either it can be a dilatation, or it can be a contraction. You know what I mean? Or it can be a relaxation, or it can be an induration. These are the four possible things in the psychotic miasm. And he further says, even total destruction of certain parts and develop faulty organic alterations here and there. These two are the syphilitic things. So in the above aphorism, Dr. Hahnemann talks about chronic diseases being most often the result of prolonged use of violent heroic medicines in large doses, and here he mentions many of them which were in use at that time. These medicines, he says, weakens the vital energy to unmerciful extent, and more often than not, the organism succumbs to it. If not, then the organism and its vital energy fights against the injurious agents. This fight he calls as revolution in order to maintain life. It is as if the organism must produce a revolution or defense mechanism against the injurious agent if it is to survive. So this is the revolution we talked about in the case of in the example of dengue. See, the hemoglobin reduces, the platelet count reduces, the total count reduces, the NLR ratio, that ratio increases. All these changes are revolution, nothing but the revolution in order to maintain life. Yeah. So these are all the soric and going towards the sorosyphilitic defense. He clearly mentions three types of revolutions: either deprive some part of its sensibility and irritability, or exalt them to excessive degree, as it occurs in complex syndrome, which follows physiologic defense, that is rubor, dolor, calor, tumor, and functionalacia. That is the first defense. After the revolution, that is sora. And then the second defense, it can cause dilatation, relaxation, contraction, or induration. Dilatation is caused by less fibrin. Yes, that is psychosis less. Relaxation is caused by less of elastin. Yes. Can you give me an example for dilatation? Anybody?
Less esophagitis. Dilatation less, psychosis less.
Psychosis less. In reflex esophagitis, what happens in GERD complaints? There is relaxation of the muscle, relaxation of the cardiac orifice. Yes, that is psychosis less, and that is because of less elastin. Where the fibrin reduces, fibrin is lesser, that is dilatation. For example, in the blood vessels, if the blood vessels, for example, in the case of an aneurysm, or in the case of a dilation of the heart, LVH. LVH illa. LVH is hypertrophy. That is more. Aortic aneurysm. Yes, Shiny. All these are examples of dilatation where there is less of fibrin. Induration of tissues, that is the third one. Induration of tissues is psychosis excess, that is caused by fibrin, excess fibrin production. All hypertrophies. Induration of the muscles. Yes, all these things are psychosis excess, fibrin excess. Then contraction of tissues. What is that? Constrictions happening in any hollow organs. All the strictures, all the strictures, all the stenosis, aortic stenosis, mitral stenosis, all the stenosis and strictures are elastin more. Elastin more is psychosis excess. So which are they? Psychosis less, fibrin less, and elastin less. Dilatation and relaxation. Hope you are all with me. Then the other one is psychosis excess. That is fibrin excess and elastin excess. Fibrin excess is induration and elastin excess is contraction. Okay. Then the third one is total destruction of certain parts. That is necrosis to save the whole. Yeah. And then the next one is develop faulty organic alterations or distortions, crippling the body internally or externally. What is the best example there? Crippling is, you have all seen that swan-shaped destruction, no, of the MP joints, the metacarpophalangeal joints in rheumatoid arthritis. That is the best example for crippling. Another example is in polio. In polio, you would have seen that, no? Altered, isn't it? Altered or faulty organic alterations. Yes. And then in the case of necrosis, TAO, that is thromboangiitis obliterans, or any gangrene or necrosis happening, the blood circulation is cut off. In the case of diabetes also, we would have seen that, no? Amputation in order to save the whole, in order to prevent the spread, etc. No? Where there is caries, you will remove that destroyed tissue, or the body itself will make it decayed or untouchable kind of thing. No, let that disease not spread into the whole body. For the protection of the whole body, certain parts will be cut off. And what is the scope of homeopathy in necrosis? What is the scope of homeopathy in necrosis? Yes. If there is a gangrene, what will you do?
We have to consider the present symptoms, like present totality, and give medicine accordingly.
Okay. Dr. Shaini Kurin is confidently saying that it can be reversed. So all these necrosis can be reversed if there is ulceration, and if there is no blood circulation, and if there is gangrene, and if there is total bluishness of all the of the digit of whichever the extremities, no? This blood circulation will usually happen in the extremities, either on a toe or on a finger, etc., or all the 10 fingers. I have seen cases like that, where all the 10 fingers are black and all the 10 toes are black. I have seen cases like that. And why is this blackness coming? Lack of oxygen. That is total cut off. It is necrosis. So what is the scope there? After giving the medicine, what do you expect? Yes, Shiny, if the proper remedy is selected, what will happen? Yes, Sai Narendra is saying absolutely you can do that. What will happen? The blood circulation will be restored. The blood circulation to that particular digit will be restored. All the 10 fingers. It is possible. Is it possible? Yes, it is possible. For all the 10 and all, maybe you will have to go that higher. So I have seen cases reversing after giving bothrops. Yeah. And the guiding symptom there was the patient was talking in a slurred language, as if he was a drunkard. That is one keynote symptom for bothrops. Okay, dears. And there was another case of a felon turned into a gangrene. There was total destruction of blood vessel to that particular digit. It started as an inflammation. What is felon? Inflammation of the nail. Around that nail, the soft tissue is inflamed. Then immediately it went into, from the sora, it immediately jumped into destruction. The blood vessel was cut off and there was pain of the whole hand. And the lady was not able to sleep the whole night. Why? Syphilitic miasm. Not able to sleep in the night. Throughout the night, she will be keeping the hand like this and sitting. and that entire digit has turned into black. And of course, we with arsenic album 10M, that entire thing was reversed. The blood circulation was restored. And what happened from the syphilis? It started oozing, the swelling happened. That means it is psychosis, construction happening there. And what happened? The pain subsided, but then the discharge was there. And slowly the discharge also, within no time, the discharge also completely dried up, leaving mild redness. And it was a soric pain. The patient was able to bear that pain. The patient was able to sleep in the nights. Soric pains will not be there in the night. No? So this was the condition. So the necrosis is, we can completely reverse the necrosis, isn't it? And what about the crippling? Now coming to the crippling, the rheumatoid arthritis, the typical distortions. Distortions and crippling, from my experience, what I shall tell you is, I have not done any magic like that. Like those people with rheumatoid arthritis who have come to me with crippling, all the syphilitic symptoms like the sleepless nights and the very, very painful nights, all those things, I was able to revert after giving a single dose of Aurum to that patient. He was a soldier. He was a BSF security, border security force person. He was full of psoriatic arthritis and he had come here like with full 10 digits. Everything is crippled totally. The crippling remained because the psychosis element is more there. It is psychosyphilitic. But then the sorosyphilitic part of it got completely cured and the patient could sleep at nights peacefully and the pains are all completely gone and he could hold his brush and all for the first time, although in a distorted angle. There is absolutely no pain. And what happened? The psychosis increased like anything and there was lot of scaling, and it took a while, and then the scaling also slowly subsided. And here, what do you do? Is this dynamism? No, this is syphilis to psychosis. And is it that, okay, you have given Oramet, now go to Oramet 1M, 10M? No, the same Oramet 200, I waited progressively, I waited slowly. The patient improved progressively from syphilis to psychosis to SORA. It took a while. It was a very slow progress, but then the crippling remained the same. And in polio, because what is that? It is a compensation. When there is a compensation, it is better not to touch that because it can be an ocean. Your ocean is unleashed. It can backfire. That because it is body's decision to cut off a part in order to save the whole. So if that part is revived, it can be a threat to the whole body. So keep it like that. Let the patient go on and on and on with that altered condition. Okay. So 10 more minutes to go. We shall read the next thing. Any doubt or anything to discuss here? All is well. We'll continue. So these above 3 groups of symptoms mentioned by Hahnemann are very much similar to what modern science states as 3 basic defensive responses of cell to injurious agents. He clearly mentions that the body adopts these 3 groups of symptoms as a revolt in order to preserve the organism from complete destruction of life by destructive forces. So one another example is between cancer and diabetes, which Dr. Vijaykar sir generally says, which is more destructive, cancer or diabetes? The patients who are coming out of cancer, the more destructive cancer, when the patient is coming out of that, he will be coming with full-blown diabetes, syphilitic diabetes, but then that is better. And the patient, that diabetes never gets cured also. The patient, because there is no time also, no? The timeline also goes on and on. But then the cancer is gone and the syphilitic diabetes continues. So all these things are different levels of treatment, no? What all things we see daily in our clinics. He clearly mentions that the body adopts these 3 groups of symptoms as a revolt in order to preserve the organism at any cost, whether it is compensatory or whether it is whatever. In the case of stroke, we have seen, no, the paralysis happening. So that is also sometimes in certain cases, if it is a very severe, a massive stroke, there will be compensatory cure only possible, only compensatory cure possible. You have to accept that. So this practically settles any argument regarding the meaning of miasms. Miasm means defensive response of a cell. Miasms are the origin of all diseases. There are and can be only 3 miasms if one understands the whole process scientifically. There is a note. This aphorism 74 is the most important, most neglected, and most misunderstood aphorism in the Book of Organon. Hahnemann has confessed in the introduction to chronic diseases that his most important discovery was not discovery of homeopathy, but the discovery of miasm. How many of you feel that this is correct? Yes. Without miasm, we can't even talk predictive homeopathy without miasm. When you say a patient, you immediately judge his miasm, right? Yes. In a letter to Dr. Frederick Goldthef Borgmaster, Hahnemann wrote in 1820 in the homeopathic writings as yet published, there is still lacking the great keystone which binds together all that has been so far published so that we may be able to improve the treatment of chronic diseases. He further writes, by thousands of experiments, I have at last attained my object. None of my pupils as yet know anything of this invaluable discovery, the work of which to mankind exceeds all else that I have ever discovered, and without which all existing homeopathy remains defective or imperfect. And this aphorism 74 holds the great keystone, the keystone which solved the mystery of incurable diseases. The keystone which revealed that the organism revolves in only 3 different ways to give rise to 3 different types of diseases at the base of which are miasms, psora, psychosis, and syphilis. See how beautifully explained. Without the psora, psychosis, syphilis, our clinic doesn't open and our clinic doesn't end. And with every patient you give the medicine, you know that, okay, if this is a syphilitic patient, in the next follow-up, this patient has to show something psychosis. And in the further thing, the patient should show something from the psoric defense. And this is our scale to measure, okay, how good our medicines are acting and how good the patient is responding. On page 34 of the Chronic Diseases, Hahnemann says, in Europe and also in other continents so far as is known, according to all investigations, only 3 chronic miasms are found, the diseases caused by which manifest themselves through local symptoms and from which most, if not all, the chronic diseases originate. Namely, first, syphilis, which I have also called the venereal disease, the psychosis or the figwort disease, and finally the chronic disease which lies at the foundation of the eruption of itch, that is the psora, which I shall treat at first as the most important. Modern researchers say the same thing, that inflammation is the first response of an organism to cell injury. The 2 morphological defense responses are only secondary to the first. The primary response of inflammation is from childhood, and no individual can survive without it. Therefore, psora or inflammation is the mother of all diseases. Psychosis and syphilis are only secondary to psora because the destructive and constructive pathologies cannot exist without the primary inflammation. Since nobody can survive without the first physiological response, nobody can be free of psora. Again, how beautifully explained. So now the importance of psora. Without psora, psychosis and syphilis are not there. At that time, first Samuel Hahnemann has first talked about syphilis, no? We all know that. First, he talked about syphilis, about the venereal chancres, and he understood that certain category diseases are following that, and he named it as syphilis. Then he later on found out that there is a category called from the condylomatous, where everywhere the tumors or the relaxations are happening, and he termed it as psychosis. And then he found out that there are certain categories which are always coming and going, showing dynamism, showing physiological responses, that is starting from the itch, and then he termed it as psora. Then he found out that psora is the baseline, psora is the foundation, without which the psychosis and the syphilis cannot exist, and that he found out through the journey of the disease, because all these people who are showing the syphilitic symptoms have undergone all the so-called psoric symptoms as well. So now, with that note, now it is 10 minutes more, some 5 minutes more. So anything to be discussed? Shiny is opening up. The case of, let me make it big. I have a case of rheumatoid arthritis with movement restricted. After giving medicine 1 dose, she improved. Blood reports, anti-CCP reduced drastically. Her pains improved. She had a sudden back pain with movement issues. I gave 1 more dose in higher potency. Now again, all values are increased. Pains increased. Actually, that should not have happened, no? You gave 1 more dose in higher potency. Her pains, okay. So everything was going on fine. So that is quite unfortunate. So everything was getting better until maybe the state remedy. Yeah, until the back pain. So you have to probe about that back pain. Something is there which is causing the back pain. Something is there in the back of the head which is causing the back pain. And that is of very importance to the patient. And when you try to help it out, it has reversed, it has backfired. All the values are increased now. So you have, from that time of back pain, you have to interrogate thoroughly. And until then, the vital force was blooming nicely with some XYZ medicine. And this back pain has made it.
ஓ அப்படியா என்னாச்சு
He is talking aloud.
ஓ அப்படியா
Somebody can inform her. Yeah. Okay. So, okay. So here, yeah, I would suggest that you retake the case. Dr. Shaini, you retake the case, giving emphasis to what was the blow at the time of the back pain, because the patient was blooming so nicely with that particular medicine. The blood
Ma'am,
value.
I gave Oramet actually 200.
Yes.
And one single dose was above 500, and it came very well, all the values and the CCPRA factor in that order how Prafful Vijaykar sir has told. No, in that same order it was coming down very beautifully. And I was also very happy. But after this, everything is coming to the higher level. Her swelling, she is not able to walk or do anything on herself. She has to be fed, like her husband or son will feed her. But after the Oramet, she slowly started eating by herself with a spoon, even though she cannot do anything else. Night pains decrease, everything was improving. But suddenly now everything is going back to the original state. So now what I did was I just gave 1 dose of Sepia, because she told when she is now again getting that severe pain and all, she feels it is better to die. So I took that suicidal disposition, miserable existence, and I just gave Sepia 201 dose. 2 weeks back I gave.
Okay. So what, since that you have given Sepia, you can always wait and see. But then here, somewhere the sensitivity of the patient remains untouched. That is the reason why it has shown the backfire. As Sai Mitra said, you can, yeah, or maybe the phenotype. Yes, Shubhangi, yes. Or maybe the phenotype, it has helped a lot. But then what we generally say is, if the values are getting better, especially in the syphilitic thing, if the values are getting better all of a sudden in such level of disease, okay, not in the lower level disease, in such level, high level of disease, if it is suddenly turned, then there can be a backfire also. Naturally, you can expire a backfire there. It has to reduce slowly. It has to reduce slowly. Anything has to reduce
slowly,
fast,
yeah.
but then slowly,
Yeah.
fast. Yeah, it is
Yeah,
reducing fast only, but then, yeah, little bit of slowness should be there. That means, I shall give you an example of what I meant by slow, fast and all. If there is an urticaria, severe full-blown urticaria, and you give them XYZ medicine, and from the next day onwards, there is no urticaria means, either there should be a Hering's law symptom, a lower level symptom there, like a cold, like something like that, no, like a cold or a running nose or a discharge from the eye or some conjunctivitis or some psoric eruption again. because this urticaria is from the mast cell destruction, no? And that is happening in the third level, in the third layer. So some second layer diseases should be produced, or some eruptions again of the psoric variety. So urticaria itself should be shown there. It should not be a sudden wipe off thing. Sai Narendra is saying, is it so that sometimes because of GCS also initial amelioration followed by full bloom afterwards? That generally doesn't happen. If it is a GCS, it touches your vitality, it touches your sensitivity as well, and the sora will come out like anything. GCS means it is the sensitivity. Whereas in rheumatoid arthritis, there is no sensitivity at all. No, what do you mean by no sensitivity? Sora is not there. Rheumatoid arthritis is of the autoimmune variety, autoimmune syphilitic thing, and sora is not there. So maybe anything, whatever is highlighted there will be of the typical phenotypical symptoms only. So when you give a medicine, it is always it so happens that it is the best possible remedy for that particular stage. And when the patient is coming out of that, you will have to catch hold of the sensitivity. Only and only then you will be able to complete the totality there, and you will be able to give the GCS, the right GCS there. And then there will be no full-blown aggravation. Maybe if the medicine is not right, then also there will be no full-blown aggravation. Sai Narendra. So,
I gave Oramet because even she is suffering from many years, madam, and she came to me last year only. I have to go to her house, visit her, and then take, because she cannot travel and all those things. So I gave the Oramet because even in that state, she was very strong. Like, the way she talks and all those things was like a brave lady. So that is why I gave it. But
yes.
I don't know why
And it has worked wonderfully, which means what?
it
Aurum
worked
element is
wonderfully.
definitely there. Aurum element is definitely there. Otherwise,
Uh,
this much relief would not have expected. The bedridden patient who has to be fed has slowly started rising up in her bed, and she started feeding herself, which means the medicine has definitely improved and all the values were coming back to normal. Then suddenly something had happened. You have to probe that definitely, and that is
Okay.
the sensitivity. Which
Sensitivity.
will, yeah,
Okay.
which will help you to find out the GCS or the next
GCS.
remedy.
Okay.
What you give will be the best medicine, and let
So
this.
if ma'am, if she's improving little bit, now directly I can give the GCS?
No, now
No.
that you have given
Again
the
it is
Sophia,
state.
yes, go slowly, go fast
Okay.
slowly. That is someone's dialogue now. I think
Mm,
Dr. Ken's dialogue. Go fast slowly, because you are not treating any psoric or psychotic ailment now. You
Okay.
are treating the highest level. That is the syphilitic autoimmune and seventh layer where the cell itself is affected. So there is
Okay.
no, you cannot change the medicine from this side to that side. It is not
Just
psoric.
wait. Just wait with the sepia for a month and see how it is happening.
For a
Okay.
reasonable amount of time. You wait, you
Okay.
take the feedback, you give
Uh,
SL, you talk to the patient almost every other day, and
okay.
you find out how the patient is slowly evolving. You
Mm,
give her all those encouragements, all the good encouragements you give her. Let the patient evolve, and at a point you will know that this patient is not improving. Then you do the case taking proper and find out her sensitivity and give the GCS. It need
Okay.
not be 1 month. It can be 2 weeks. It can be 3 weeks. It can be 6 weeks. Anything.
So by that time, all this anti-CCP has to come down, right? To give a GCS.
Yes. Let the patient speak rather than the
Okay.
paper. Yeah.
Okay.
Yeah,
Okay.
the improvement will be shown by the patient's face, no?
Hmm.
The
Hmm.
patient's
Hmm.
vitality, the patient's energy, the patient's willingness to live, all those
Hmm.
things will be there. And then eventually you do the blood test. There is no urgency from our side to the before sepia, after sepia
No,
and all.
no, 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 nothing like that. I do only once in a year only the test,
Yes,
ma'am.
yes, yes. Wait.
Because they are financially also not so sound to
Yes, yes.
do the test regularly.
Correct, Saini. There is no hurry to do the blood test at all. Let the patient's improvement speak for itself. Okay, dear?
Okay.
Let
Okay,
that
ma'am.
guide you
Thank you. Thank you.
to
Thank you.
select the GC.
Ma'am, one more doubt, ma'am.
Yes, dear.
Ma'am, similarly, in the case of autoimmune thyroiditis, so where TSH was almost more than 400, ma'am. ATPO, ATG was very high. It was almost 700, so like that. So I gave 2 to 3 medicines initially. Patient is not responding. So finally, I gave her lycopodium with some 2 to 3 rubrics. So she improved quite very well, ma'am. Mentally, physically, she was absolutely fine. I was feeling happy. So she's improving. But suddenly, values also came down. It came to almost 150.
The
ATPO came from 700 to 150 ATPO came.
yes,
So TSH from 400 to it almost came to 150 TSH. So suddenly nothing has happened at the home.
there.
So suddenly all of a sudden it went to 400 TPO and TSH it went to almost 350 again. So here I thought that maybe lycopodium was her GCS. So I thought that initially it might have ameliorated her. So again it got aggravated. So again I retook the case. Now again I have changed. I gave lycopodium in the higher dose also. 2 doses already I gave. Initially I went with 200. Then I gave her 10 m 2 doses. Monthly 1 dose like that. So finally she was not improving. Everything got worsened. So again retook the case. Now I gave her NASA. I gave her. So here, what mistake I have done? I don't know. Can you please explain that?
Lycopodium has helped you partially here, and then there was lot of fluctuation and all. It has gone back. When it has gone back, you have always tried out with the higher potency. That is a good decision. Lycopodium 10 you tried, but then that also didn't work. Means again, you will have to change the medicine. So somewhere it can be a complementary of lycopodium, since lycopodium has helped you once. So it is a medicine, medicine from the family of lycopodium or a complementary of lycopodium, because it has helped you a lot. But then don't get prejudiced with lycopodium at all. You actually you have to retake the case and change the medicine. That is the only answer. But then since there is high levels of fluctuation, I will always suggest you to give the medicine in 10 m potency. Okay, Sai Narendra?
Yes, ma'am. Yes, ma'am.
The next medicine.
No, I gave her NASA 10 m only. I gave ma'am this time. I didn't go by 200, so I gave her 10 m only.
Yes, because it is autoimmune and high levels of fluctuations are there anyway shown in this person. So you can always think about the next medicine in the 10 m potency. Go slow.
Yes. Yes,
Go slow fast. Okay. So with that positive note, let us wind up today's lessons. See you again next week. Bye, dears. Take care and have great practice. For all of you, I wish great practice. Great success in your practice.
Thank you.
Thank you, ma'am.